Federal government says it has no plans to impose a second COVID-19 lockdown in the country, considering the impact of the 2020 outbreak. It advised Nigerians to obey health protocols in view of the ongoing second wave of the pandemic globally. The Minister for Information and Culture, Lai Mohammed, who made the disclosure, lamented that most Nigerians were not adhering to safety measures such as wearing of face masks, warning that the disobedience could worsen the spread of the disease. Meanwhile, in the UK, Prime Minister Boris Johnson has said that everyone in England must stay at home except for permitted persons during a new coronavirus lockdown expected to last until mid-February. He warned that the coming weeks will be the hardest yet amid surging cases and patient numbers. So joining us now to discuss this is the CEO, Occupational Health and Safety. Good morning and Happy New Year.
Happy New Year to you, Mike.
Great. Now, I know you would have heard a lot during the Christmas and New Year period. So many videos went viral of beaches and shopping malls packed full with human beings all over the place. And we heard the DG of the NCDC at the time saying that there's going to be consequences in January and February from all the activities that happened, the violations that happened during the Christmas period. I wonder what you saw and what your assessment is. Let's start from there.
I wasn't just seeing the videos, I was also observing the trends. Because you can't eat your cake and have it, and that is the way we can put this. And I see this as government also being culpable in this regard. Because beaches were opened, that was that people could access those beaches. What I would have thought, and will come from government as we approach the Yuletide period, was to give a strong warning and sign an executive order that beaches are going to be closed from 20th of December and open maybe on the 10th of January.
To prevent people from...
Yes.
Okay.
Once you say that, not just saying that and put it on the page of the newspaper, it has to come out every day on our daily news so you wouldn't say you didn't hear. So, but we left the beaches open, and that was why people could access it. You know Nigerians for who they are. I mean, when I saw the pictures, I was worried because what we gained in our past actions,
we have lost it.
We lost them.
This 2-week period.
At a point, my children brought videos to me that we're seeing on Twitter and social media. Why are you keeping us at home? But look at people outside. I told them because I'm in charge of this house.
Oh yeah,
nobody's
for the
out.
home and the commander-in-chief.
But it not look like we are the
You're
odd
depriving
people.
them
Yes,
of something.
But the truth is, we should have done something better before Christmas started. I mean, just close the beaches, give strict orders on nightclubs and parties. I mean, this we didn't do. Now, the impact, we saw the figures. I think I need all of us to keep an eye on that figures. That's already over 1,300 daily cases. Just keep an eye on that figure because what we did wrong in this
the Christmas period,
we are going to see the figure actually coming up.
Now, but what do you make of the government always, in fact, from the whole of last year and then to this second wave, government has been expressing its frustration. People are not adhering to the COVID-19 protocols. The Minister of Information has said it. The Minister of Health has said it. The NCDC DG has said it. Federal government has said it. PTF has said it. The Commissioner of Health, Lagos State Governor, all of them, all the governors, they have said. How frustrated or how helpless is government when it comes to, the people are not adhering to this thing and then there's nothing anyone is doing about it?
You know, when you look at those non-compliance behavior, it's called behavioral-based safety concerns. Okay. People don't conform to issues except you force them. And we saw that. And that was why during the military era, force were used for people. You know, with the time we had to queue up at the bank. It was compulsory. The state that we are right now... But
nobody wants to go back to those days anymore.
I agree. The state that we are right now, we have to use consequences to drive compliance. Because where there is no consequence or penalties, people don't... I mean, I like what government did with the people...
With the 65 people who were fined
let's start with that.
for violating
I think
the curfew.
Above all that, I mean, we need to keep strengthening the discussion and the conversation as it concerns COVID-19. we need to understand that this is not just about government, it's about all of us. It's about the father or a mother telling his or her children what are the importance of wearing nose masks. We need to, let's move from just waiting to hear television. Let's use what you call the family-centered approach, where it becomes compulsory because I tell my children, when you go out without nose mask and you get infected, you put all of us in danger.
In danger, exactly.
And this is how the chain of infection is. Governments, I mean, the cry is loud enough, but to get people to comply is just a problem. I think this also has to do with some level of poverty we have in the land. People want to, if you say stay at home, before you know that people have dashed out there in the street, go to the market, you'll be amazed, Mike. What happens in the market? Go to Lagos Island Market, go to even any market, you see that people are not concerned. We talk about social distancing. That is not in an English they want to hear in the markets. So they just do business as usual, but I'm even worried why the figures are still as low as we are saying, based on the behavior that we have displayed.
Yeah, there is
a big issue.
There is also the discussion of not testing enough. The agencies are not testing enough. So the figures we get is based on their capacity to test people and all of that, because the number of people who some are not getting to the hospitals. We get calls sometimes here and there, and from people who want to make inquiries here and there, and then we direct them, giving them the numbers, official numbers, and all of that. But is there anything government can really do before we go there, Mike?
I think we also need what you call regional cooperation. You know, we have countries that share boundaries with us as a country. I think as a matter of urgency, the government of those countries should start discussing collaboratively. And I brought this up because of what I saw happen in Ghana. I mean, I was wondering at some point if Ghana was not immune to COVID-19.
Wow.
I mean, we talked about Nigeria, but Ghana was a crisis. The beaches were open, clubs were open. You know, at a point, those who felt they couldn't go to, artists who felt they couldn't go to beaches in Nigeria, they started flying to Ghana.
Whoa.
And now they fly into Ghana, mingle with people. I mean, that's a high level of exposure. Then they come back to Nigeria. But I don't understand why we talk about COVID-19 and as government pay lip service, I mean, we fight COVID-19, but what we ought to do, we're not doing it. Even in Makurdi, there's a government in that state. But there was a carnival in Makurdi during this period. But when you look at all this, you begin to wonder if we are all actually on the same page, or people have a different program that they are running outside what we all know.
Or maybe some people have already taken their own vaccine ahead of time. We don't know. So Ghana was the platform for people to go and party hard,
absolutely.
And then come back. No, but the issue there is, if we have to look at the nitty-gritty of it, now, everyone is saying the issue of enforcement and forcing people not to and all of that is going to be very challenging.
Definitely.
Because we don't want to see soldiers on the street, and on the roads, mounting roadblocks here and there, forcing people to... nobody wants to see that. Sure. But how do we balance between the persuasion of talking to people and ensuring that they abide by these things? Because you were talking about the family setting earlier on. A lot of... very selective or randomly selected parents will certainly be engaging their children. The others are just very busy doing their things.
You know, when you get to a point that we are in right now as a country, you start making what you call emotional appeal. And such emotional appeal communication we'll be using, like I say here severally, is start driving at people and letting them know what they stand to lose. You know, when people know what they stand to lose, I mean, that will drive them doing the right thing. But I think, like I said the other time, what we should do right now is that we should start looking at engaging community leaders. They are closer to the people. And if you look at people who are really gullible, I mean, who present themselves with this kind of behavior, most of them are really the community people. Let's start engaging our people. I mean, this is what it is. We need you guys to be alive. I mean, the loss of a life is not a plus to any one of us. Such emotional communication, emotional appeal has to be a strategy that we have to use right now. We have used all that we have to use. I'm sure government has even exhausted all they have to use in terms of communication. But when we have such behavior still prevailing, we have to go back to our drawing board, sit down and think, what other forms of communication or persuasion mechanism do we use to get results? Because you have to measure the result you have gotten from what you have used.
Exactly.
If the result is not commensurable to what you really...
You change strategy.
Yeah, you have to change strategy. We have to look for... It's not just about government. Government needs to start engaging people who have strength in these areas and see how we can get people engaged and see how we can get the right behavior.
On the other hand, do you think there is information fatigue? Sometimes you hear this thing over and over and over again that it makes you feel... Yeah, it's the same thing. With the concept of wearing face mask, a lot of people have heard this thing maybe 1 million times. Yeah. Maybe exaggeratedly. Yeah. But the point there is, these messages still have to go out. But do you think, if you flip the coin, people have heard this thing so much that it's no longer having effect? Especially when they're saying no cause for alarm.
Let me tell you, Mike. Do you know most people wear nose masks because they don't want to be arrested, or they don't want...
The fear of being arrested one way or the other.
But they don't know why they are really wearing the nose mask. So when you do something because of the legal imperative, of the legal consequences, or without knowing why you are really meant to do what you're doing, we need to start sounding that note. Not because we don't want government to stop us or arrest us.
Or you just want to gain access to somewhere.
Exactly. Yeah. What is the real reason? I go to some shops, and you said, I mean, it was good enough. I was in a pharmacy yesterday.
Okay.
I went to buy some things. And right in the pharmacy, good process. I had to wash my hands. They had a hand washing stand outside.
When you're coming in.
Yes, I had to wash my hands. There's a dryer. It was very okay. I went in with my nose mask. I did all I had to do. But while I turned, I saw a cleaner who works for the pharmacy. She was cleaning. She didn't have a nose mask. So when I turned, I asked the people, why will you enforce nose mask on me when you have somebody inside this place that's not wearing a nose mask?
Exactly. Because it doesn't make any sense.
Exactly. So obviously, every other person was wearing nose mask. That lady that was cleaning, it means she doesn't understand why she had to wear nose mask. So we need to strengthen the education, awareness, advocacy. I mean, it can never be enough. But what I think we should be doing is seeing how we can maybe retweak our strategy, ensure that it reaches people in their different languages and in the way that it appeals to their emotion. Until a message appeals to us and it breaks our hearts into conviction, we can do the right thing.
Now, talking about the issue of lockdown, we know what's going on in the UK right now, and also part of South Africa where they're talking about the new variant, and the part of the UK is on lockdown. Almost the entire country is on lockdown. Some people were saying, as a way of being proactive, we should be locking down right now. But others are saying, you see, Nigeria cannot afford another lockdown in that context. What do you make from that window? Although government is saying we're not considering the issue of lockdowns yet, we're still watching, what's going on and checking the trends.
I think if we as a people actually cooperate with government, we can work around this issue, managing it safely, and we come out better out of it. But the difficulties I think government is having right now is the people. The people are not cooperating or complying with what process the government has put in place. Lockdown, for me, is not something we can afford at this time as a country. Nigeria as a country, we're already undergoing recession. And now you want to lock down again. No, it will be difficult, but I think this is where it takes us back to where we have to change our approach. What do we do differently that can get people to put up the requisite or good behavior? One of the things we can do is, talk to organizations who want, maybe 20% of your staff to be in the office. We're not locking down, but those that can work, let the majority of them work from home. What that does for us is that it takes a lot of people off the street. The less people, the more people you have on the street, the more exposed we are, the riskier it becomes for us. But let's take a lot of people off the streets and confine to their home. I mean, we can manage our home and process our home, but this is a way to it. But I don't think lockdown is what we can afford as a country for now.
All right. Now, as we round off now, one of the debates one of the issues on the front burner right now is the issue of availability of vaccines. Nigeria will be expecting about 20 million doses of its vaccine sometime within this month. And from what the Minister of Foreign Affairs said, they're also trying to see how they can get another batch of vaccine from China and so on. But the concern generally is the chain, the process of storage and preservation. Because I spoke to some professors of medicine and all of that yesterday, and they were saying the moment you bring a vaccine into a new environment, and the specification is that you should keep it within a certain cool temperature, and if you don't, then the efficacy of it is gone.
Totally.
I wonder what concern you have from that window.
You know, there's what you call the chain of custody of vaccine, and the fear, which of course that professor allays, having vaccines that are not potent. So you find out that because you are not able to maintain the cold chain, you have vaccines in the country that are administered to people. We live with that false impression that we had the vaccines, and meanwhile
they
vaccines are
won't
not
work.
potent. And the truth is that even the vaccines that have been, some of the vaccines that have been discovered, they need to be kept under a very low temperature, atmospheric condition. And I don't know how we can afford that here. Though we have a cold chain management system because Nigeria has always imported vaccine. But this one has to be kept in a very cold environment. But I don't know how we're going to manage the chain. But I don't want us to just bring in those, be in a rush to bring in those vaccines when we know we have no capability to manage those things. And we administer those vaccines to people, and they live with the false claims that they have the vaccine, only to find out that after 3 months or 4 months after they've taken the vaccine, here they are infected again. But these are the issues we should sit down as a country to discuss properly before we embark on this vaccine.
I just imagine what the DG of the NCDC, Ministry of Health, PTF, I just imagine how they sit down to discuss how to handle those issues. But we wish them well because they have the responsibility to tackle that right now. Thank you so much, Ahiden, for your time on the program. Really appreciate you.
Thank you so much.